Hi, my name is Alyssa Kell, and today I'll be teaching you about the forearm, wrist, and hand. So first we have a picture of an anterior view of the right forearm bones. So you can see the radius and the ulna. On the proximal end of the ulna, you can see the olecranon process, which is the posterior pointy part that you might call your elbow bone. And this fits into the olecranon fossa on the posterior humerus. Next, you can see the trochlear notch on the ulna. This articulates with the trochlea of the distal humerus. And then here you can see the radial tuberosity and the ulnar tuberosity on the radius and ulna. And these are protrusions that muscles attach to. And then on the distal end, you can see the styloid processes of each of the radius and the ulna. And these are palpable bones that you might call your wrist bones. And then finally you have the head of the radius, which articulates with the capitulum of the distal humerus. And the head of the radius rotates to produce pronation and supination. Okay, next we're looking at an anterior view of the right hand bones. So first you have 8 carpal bones, which sit in 2 rows of 4. The proximal row consists of the scaphoid, lunate, triquetrum, and pisiform, and the distal row consists of the trapezium near the thumb, the trapezoid, capitate, and hamate. Next we have 5 metacarpals. You have 1 for each digit. You start counting your digits with the thumb as number 1, and then count up as you go medially. And then finally you have 14 phalanges. So digits 2 through 5 each have a proximal, middle, and distal phalanx, and then digit 1, or the thumb, only has the proximal and distal phalanges. So the thumb is unique and it allows opposition, which the other fingers do not. Okay, and now we have a view of the superficial muscles on the anterior forearm. So we have 4 muscles that all originate on the medial epicondyle of the distal humerus. So most of the anterior muscles will flex the wrist or digits. But our first one is the pronator teres, which goes from the medial epicondyle to the shaft of the radius, and this muscle produces pronation of the forearm. Next we have the flexor carpi radialis, which goes from the medial epicondyle to the base of the second and third metacarpals, and this muscle flexes and abducts the wrist. And then next we have the flexor carpi ulnaris, which is on the ulnar side or the medial side of the forearm. And this goes from the medial epicondyle to the hamate, pisiform, and the base of the 5th metacarpal. And this muscle flexes and adducts the wrist. And then next we have the palmaris longus, which goes from the medial epicondyle to the palmar aponeurosis and the flexor retinaculum. And this muscle also flexes the wrist. And then here we have a view of our intermediate forearm muscles, where we just have the one that we're looking at, which is the flexor digitorum superficialis. And this attaches to the medial epicondyle proximally, and then the middle phalanges of digits 2 through 5 distally. And this muscle acts to flex the wrist and digits 2 through 5. And all of these muscles, except for flexor carpi ulnaris, are innervated by the median nerve. And the flexor carpi ulnaris is innervated by the ulnar nerve, as it's the most medial. Okay, so here we have a cadaver view of the superficial and intermediate forearm muscles, and this is an image of the right forearm. And you can see a sliver of pronator teres right here. And remember that goes from the medial epicondyle, to the shaft of the radius. And then you have your flexor carpi radialis, which goes from the medial epicondyle to the base of the metacarpals 2 and 3. So here's the tendon of the flexor carpi radialis, and you can see it going in through the thenar muscles. And then here you have the palmaris longus, which also originates on the medial epicondyle, and that inserts onto the palmar aponeurosis and the flexor retinaculum. Here's the tendon. And then you have your flexor carpi ulnaris, which originates from the medial epicondyle and inserts onto the hamate, pisiform, and fifth metacarpal on the medial side. And then finally you have your flexor digitorum superficialis, which originates on the medial epicondyle and then inserts onto the middle phalanges of digits 2 through 5. And next we have a view of the deep muscles on the anterior forearm. So first we have the flexor pollicis longus, which originates on the anterior radius and inserts on the distal phalanx of the thumb. And this muscle acts to flex the wrist and thumb. And next we have flexor digitorum profundus, which originates on the anterior ulna and inserts on the distal phalanx of digits 2 through 5. And this muscle flexes the wrist and digits 2 through 5. And both of these muscles are innervated by the median nerve. Okay, so here I have a clinical correlation for you. And we'll be looking at jersey finger, which is an injury of the flexor digitorum profundus tendon. And this can be either a tendon avulsion, where the tendon rips off of the bone where it attaches, or a rupture in the middle of the tendon. And if you have jersey finger, you'll be unable to flex the distal interphalangeal joint, or your last knuckle. And this is caused by a strong extension force applied to the distal phalanx while you're trying to flex it forcefully. And this may cause a pop when the injury occurs. And this injury commonly occurs in football or rugby players when they reach to tackle their opponents and their finger gets caught on their jersey, hence the name. And when the tendon is torn, it might retract into the digit or the palm. It commonly stops near the proximal interphalangeal joint, and if it retracts all the way into the palm, then surgery is urgent because it likely disrupts the blood supply to the digit. And then after surgery, the athlete will need dynamic splinting and therapy. And then in the top right picture, you can just see the two different ways that the tendon can tear. Here is on the top letter A, is when the tendon avulses from the bone, and then here you have the tendon is torn. And then on the bottom picture, you can see a patient with jersey finger, and he's unable to flex that distal interphalangeal joint. Okay, now we're looking at the posterior compartment of the forearm and the superficial muscles. And the first muscle, you can actually see it from an anterior view, but it is in the posterior compartment. So it's an exception because it also flexes the elbow, which is usually an anterior muscle. And this is the brachioradialis, which attaches at the distal humerus and then at the distal lateral radius, and it acts to flex the elbow. And then next we have the posterior view. So our first muscle is the extensor carpi radialis, which originates on the lateral epicondyle of the humerus, and it inserts on the dorsal side of the fifth metacarpal, and this acts to extend and adduct the wrist. Next, we have extensor carpi radialis longus and brevis. These are two muscles that both originate on the distal lateral humerus and insert on the dorsal second and third metacarpal. And as you can tell by the name, the longest is just slightly longer than the brevis, but they run along with each other. Next, we have extensor digitorum, which originates on the lateral epicondyle and inserts on the dorsal surface of distal phalanges 2 through 5. And this acts to extend the wrist and digits 2 through 5. And all of these muscles are innervated by the radial nerve. And here you have a view of the deep muscles of the posterior forearm. So here we have extensor pollicis longus, which originates on the posterior ulna and inserts on the distal phalanx of the thumb, and this acts to extend the wrist and thumb. And this is innervated by the radial nerve. Now we'll be going over a coloring book page to learn about the intrinsic hand muscles, and the first group of the intrinsic hand muscles are the thenar muscles, which control thumb movement, and they're all innervated by the median nerve. The first thenar muscle that we'll look at is the opponens pollicis, which acts to produce thumb opposition and circumduction. And you can see this on the deep palmar view and the superficial palmar view on this coloring sheet. Next, we have the abductor pollicis brevis, which is a more superficial muscle that produces thumb abduction, which is moving the thumb away from the middle finger. Our final thenar muscle that we'll look at is the flexor pollicis brevis in orange, and this is another superficial muscle that flexes the metacarpophalangeal joint of the thumb. So next we're looking at the hypothenar muscles, which all control movement of your fifth digit or your pinky finger, and they are all innervated by the ulnar nerve. And the first muscle is the opponens digiti minimi, which works with the opponens pollicis to produce opposition. In yellow, we have the abductor digiti minimi, and this muscle acts to abduct the little finger or move it away from the middle finger. And you can feel it if you fan out your fingers, and you can feel it on the most medial side of your hand. Our last hypothenar muscle is the flexor digiti minimi brevis in pink, and this muscle acts to flex the metacarpophalangeal joint of the little finger. So finally we have 4 deep muscles remaining. The first one is the adductor pollicis, which adducts the thumb or pulls it in towards the middle finger, and this muscle is innervated by the ulnar nerve. So now we have 2 sets of interosseous muscles. The first set is in purple, and it's the palmar interosseous muscles, which adducts the fingers at the metacarpophalangeal joint. And then after that in gray, we have the dorsal interosseous muscles, which abduct the fingers at the metacarpophalangeal joints, and both of these are innervated by the ulnar nerve. So one way that you can remember the actions of each of these sets of interosseous muscles is that palmar muscles adduct, so pad, and dorsal muscles abduct, so dab. Okay, and finally we have our lumbrical muscles in green, and you have 4 of these, 1 for each digit, 2 through 5, and these are worm-like cliffhanger muscles because they extend your interphalangeal joints of digits 2 through 5, and they flex the metacarpophalangeal joints of these digits. And the lateral 2 lumbricals are innervated by the median nerve, and the medial 2 are innervated by the ulnar nerve. Okay, so finally we'll be looking at the blood vessels of the forearm, wrist, and hand. So we're going to start with the arteries in the anterior right forearm and hand. So the brachial artery in the arm branches into the radial and ulnar arteries in the forearm, which then branch again and reconnect to form the superficial and deep palmar arches, which branch to supply all of the digits. And then The deep veins are actually the same as the arteries, so we're not looking at those. But the superficial veins you can see here on the anterior right arm and part of the forearm. So the cephalic vein runs from the lateral wrist up the lateral forearm and arm and drains into the subclavian vein. And then the basilic vein runs from the medial wrist up the medial forearm and continues up the arm and drains into the axillary vein. And these two veins are connected by the median cubital vein in the cubital fossa.